Hello, this is Dr. Lewerenz, Longevity Health Institute. I hope this finds you well, and I hope this informs you even better. So here we are in the end of June, and getting back to kind of normal, everyday, functional primary care, personalized practice and medicine that we do here at Longevity Health Institute, me and my practitioners. And what does that mean? Well, that means getting to the root cause and being a personalized approach to looking at things like even dementia, cognitive, neurodegenerative issues. And we see some tough cases and we see unique things, and we try to look deeper than most so that we get to the root cause and we can be way ahead of the curve and be all about prevention. We love tracking things and having data and evidence-based medicine so that we can follow things. So I want to share with you a new study and new evidence that just came out and just published in John Hopkins journal, and also a study that was earlier presented in the June article of Neuron, a neuroscience journal. And it's based on how your gut and gut flora and gut health, and you've heard me talk about this on other videos and many times if you follow me, and that is your gut health can actually impact Parkinson's disease. And I'm going to tell you that we have seen cases here with Parkinson's and other neurocognitive degenerative issues, Alzheimer's, and that when we work on the gut, when we work on the diet and gut flora, okay, these symptoms improve, okay? We're going to learn more and more about what actually bacteria, what part of the microbiome, what part of your gut flora, literally what bacteria as the years go by and I think studies go on. But this journal, an article, that was published in Johns Hopkins and in Neuron showed that in animal studies, when you altered and improved the digestive flora, Parkinson's symptoms improved. So let me tell you some stories about some cases we have here. Now, we look and investigate really early on when somebody has tremors, memory issues, gait issues, and signs of something that might be cerebral or supratentorial or again, cognitive and neurodegenerative. We're not going to sit back. We're going to look at things like their gut flora. We're going to investigate their diet and their gut lining. You've heard me talk about leaky gut and the digestive barrier. That's eminent, huge. In every person, everybody out there, we have to be on top of that. Even to speak of that's huge for your immune system. So your diet, gut health, gut lining, that defense, that barrier in your gut lining is almost everything. It's not everything, but it's almost everything, okay? And so the sooner you're on that, the better. And if you track numbers in patients, we track a number that has to do with a peptide and a protein that's released from the brain, so that if you actually have a weakened blood-brain barrier, then things that are toxins and inflammatory and sugars and heavy metals can cross your blood-brain barrier sooner and cause neurodegenerative disease. But you have to be looking at this at 30 and at 35 and at 40 and 45 and etc. You cannot wait till that disease presents itself. You're too late. Now, if you can be preventative and you get to the underlying cause, okay, I think that you're going to find that as the information and the studies and the science develop, okay, we are going to be right on target with your gut flora and gut health. So, keep this in mind for my patients out there and family or friends that know of somebody that has Parkinson's. The rates of Parkinson's are going up, just like the rates of Alzheimer's are going up. And I want to share a couple stories with you about a couple patients that I've had, because they're really interesting, that when they were diagnosed and had some significant tremor and gait, we did some things with colonics, altering their gut flora, opening up actually their glutathione pools to their liver and to their body, and doing things that re-inoculated a lot, and I mean billions of good bacteria to their gut, and their symptoms would improve, and sometimes within days or week, their gait and their tremor would improve. I was even impressed. And that's when we use things like coffee enemas and bacterial seeding with high dose live pre and probiotics and change their diet. And so if they have a toxin or if they have a heavy metal in them, first identifying it and then getting it out of them. But you got to be proactive. So again, a study that showed that your gut is connected to your brain again, that it can actually alter and you can be preventative and even improve Parkinson's is out there now. We've suspected this for years, but that's actually published and out there now, which is awesome. And you have to remember always about being in a functional model. We're going to track and trend things in numbers that whether you're diabetic, whether you're talking about cardiovascular, whether you're talking about hormones or nutrient levels or inflammation. But when you trend and track things, okay, and you have data, you can not only get results, but you can be like, hey, I don't care how I feel, something's off because this number altered. Why did it alter? It's great to feel and function highly and thrive, not survive, not just survive. And we're all about that here at Longevity Health Institute. But you also have to have data and scientific information that correlates with what a patient to be in that preventative model. And that's what we do here. And happy and proud to do that here. So again, this is Dr. Lewerenz, Longevity Health Institute. We do accept new patients. Try to get you in as soon as possible. It's been kind of getting full and loading up because of post COVID-19 boom. We're still in the pandemic, but things are becoming slightly normal and seeing a little bit of the curve flatten. But we are taking new patients. We do telemedicine from around the country. We are in the office every day, me and my providers, and we will always bring you the best in personalized functional medicine and get your health foundation solid, including your brain and memory and cognition and things to prevent, unfortunately, like Parkinson's. So I hope this finds you well and informs you even better. Dr. Lewerenz.